Hey everybody, welcome back to the Doctor is In Live with TOA. Gray Stahlman here, I'm your host. Again, for those of you who haven't been part of this with us, I'm an orthopedic surgeon here with TOA. I've been in practice nearly 25 years and have gotten into doing this format of information and hope that y'all find this interesting and helpful. I would like to remind you that the information we're going to talk about today should be considered for entertainment and educational purposes only. While I am an orthopedic surgeon, and I might actually be one of y'all's orthopedic surgeons, I'm not acting like your surgeon today. So if there's any kind of medical problems, you're concerned about something, really seek out a professional, someone in our practice to help you with your problem. We're just going to talk about some information, but I'm not going to be responsible for what happens with you, if you understand that. So, today is episode number 4. We're actually trying to get better with this, and I hope we are. We've got some new equipment, and I think things are going to be looking better and better as time goes on. Today, we're going to talk about a problem, probably the most common surgical problem in the older person. Episode number 2 was about ruptured discs, which was the most common surgical problem in the younger person. In the older person, problem associated with degeneration is really the most common thing we see, and that's a problem called spinal stenosis. So before we get started, our pearl of wisdom today is the definition of spinal stenosis. So stenosis means narrowing. It just means getting smaller. Spine, obviously, is part of your back or your neck. So spinal stenosis is narrowing in the spine, and that's what we're going to talk about today. So, just like always, we're going to talk a little bit about what this problem is, what is spinal stenosis, what causes it, what are the symptoms of spinal stenosis, how do we diagnose this, and finally, what are the treatments for spinal stenosis. So let's get going and see if we can get some information to you. So, what is spinal stenosis? Well, again, spinal stenosis means narrowing in the spine. In general terms, spinal stenosis comes from the aging changes that develop in the body. As we age, we develop arthritis in the joints of the spine, which are these guys back here in the back. We develop aging or degeneration changes of the discs, which are the shock absorbers in the front. And what happens is the joints tend to get bigger. Calcium deposits build up on the joints. They get larger. The discs start to squish down. They collapse down. And so you can see the two bones here can get closer together. The way the spine is built, it's essentially a stack of bones and discs that creates a tube or channel which runs down this way, which is where the nerves are. And then the nerves, these yellow guys here, also come out at each level where there's a disc, and the hole where they come out is made up of part of the top bone, part of the bottom bone, and the joints. So that hole, when the discs get smaller and the joints get bigger, gets smaller. And what happens with spinal stenosis is you start having trouble primarily with nerve pressure, okay? So it develops over time usually. Many people will tell us that they don't recall anything happening to set this off, and that's typically the case. And it can be a very gradual problem, which means it actually has been going on a lot longer than they really realize. Typical symptoms of spinal stenosis are pain in the lower back, pain down into the hips, and pain down in the legs, especially when people stand or when they walk, okay? Classically, or the big story that we learned in medical school was they tend to get better if they can sit down or bend over, okay? That's kind of the classic story. What people come in and tell us is, I can't walk like I used to. I can't stand like I used to because pain, particularly in my back or down in my legs, keeps me from doing so. And it's gotten worse and worse and worse. I used to be able to walk for miles. Then I could only walk for a few blocks. Now I can only walk to my mailbox before I have to sit down. That's really a sign of spinal stenosis. Now we're going to talk about today spinal stenosis in the lower back. Spinal stenosis can happen anywhere in the spine, and it can cause pinching or pressure on the nerves anywhere in the spine. But because the lower back is by far and away the most common area we develop this. We're going to kind of concentrate on that. Spinal stenosis in the neck, for example, can cause arm pain or numbness and tingling, and we'll save that for another day, another topic, okay? So again, symptoms of spinal stenosis are typically back pain and leg pain, numbness, tingling, and even a sensation of weakness. In addition, and sometimes this takes a little bit of sussing it out from the patient, people actually talk about having trouble walking with regard to balance. They catch their toe, they stumble, they shuffle their feet a little bit. That's actually a fairly advanced finding with spinal stenosis, where the sensation that the brain uses to tell what's going on in the world gets messed up. This is a sensation called proprioception. So we have the sensation of vision, seeing, hearing, feel, touch, those types of things. Well, there's a kind of a background sensation called proprioception, which is basically how your brain communicates with the world and tells what's going on. So, for example, when I close my eyes and I put my arm out to the side, my brain knows that my arm's out to the side even though I'm not looking at it. That's a sensation of proprioception. Well, proprioception in the feet allows you to feel where your feet are on the ground. And that can get messed up, and that can cause people to stumble, fall, shuffle their feet, that type of thing. There is a similar symptom complex to spinal stenosis that we always have to think about when we're looking at somebody with spinal stenosis. And that's related to poor circulation. The classic symptoms of spinal stenosis is back pain, hip and leg pain radiating from the back going down toward the feet when you stand and when you walk. The symptoms associated with poor circulation, which is also called vascular claudication. Spinal stenosis symptoms are called neurogenic claudication, or nerve-related problems with walking. Vascular claudication typically starts at the feet and works its way up. Similar types of sensations, pain, numbness, tingling, and whatnot, when people walk, when they're using their legs. Almost always, if they stand still, those symptoms go away. That's different than spinal stenosis. You got to get into a different position in order to relieve the symptoms of spinal stenosis. And those positions are what are called flexion, or bending forward. So the classic story of somebody with spinal stenosis saying, yeah, I walk and it hurts, and if I can sit down, I feel better. Sit for a few minutes, symptoms go away, I get up and go, and it starts all over again. Or I walk into Walmart and I can't walk very far. I have to lean on the shopping cart in order to get through the store. What's happening in their spine is when they lean forward or when they sit, they're bending forward like this. And what that does is it opens up the space for the nerves. When we stand, when we walk, we have to arch our backs backwards some in order to keep our head on top of our hips. And that actually narrows the space for the nerves, okay? So I'm going to show you a picture of somebody with spinal stenosis, kind of a normal and an abnormal, okay? So this is an MRI. This is basically the way the MRI works is a set of pictures that are kind of like slices of bread. So think of a loaf of bread with a bunch of slices in it. We're slicing the body horizontally. Patients laying on their back when they're having the MRI, so they're laying down here. The loaf of bread slices are like this. And in this picture, the feet are out to the front, slice, 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 and the head's back that way. So this is your right side, this is your left side. This is the front, this is the back. And so this is a coned down picture of the spine. And remember, the spine is kind of like a tube where the spinal nerves and spinal cord run up and down. And so the tube is right here. This white area, this is a normal, okay? So this is a white area. This white area is the area where the nerves are. The disc is in the front, the joints are in the back, and then we see muscle tissue here, and this is intestines and belly stuff in here. But you can see this is a normal area, and the space for the nerves is really wide open, about the size of a big nickel or something like that. This is the same patient at a different level. You notice here, again, front, back, right, left. And what we see here is, where's the white stuff? Well, it's really actually this kind of squished down section down in the middle there. This here is a big wide open joint. Here's another big wide open joint. So it's effectively like the joints are squeezing in and making that space narrow. And that's squeezing on the nerves in this particular patient that go down to the patient's hips and legs. So that's what we look at on an MRI to help us diagnose spinal stenosis. Okay, so what do we use to diagnose spinal stenosis? Well, the first and foremost thing is the patient's history, the story. How does it hurt? Where does it hurt? What makes it hurt? What makes it feel better? As you can see, we can actually tell in many cases one process versus another simply by the story. So the story is really important. The second thing we look for is physical exam findings. Interestingly, most of the time with spinal stenosis, the physical exam is pretty normal. We usually don't see nerve weakness or muscle weakness. We don't see losses of sensation and things like that until stenosis gets pretty bad. And then we can start seeing some weakness in the legs. Sometimes people will have a foot drop where they can't raise their foot normally like they should. They may have some changes in the skin, the hair patterns on their legs, and that type of thing that can potentially be associated with this. One of the things we also look at is the pulses, the blood flow into the legs. You know, normally when somebody feels your pulse, they feel your wrist or your neck here, and you can feel the heartbeat. That's the blood pumping through the arteries in your body. The legs have arteries too, and we can feel that sensation, that pulse down in the feet. If somebody has really bad circulation, maybe you can't feel the pulses, and that might give you a clue, in addition to the history, to think, maybe they have a blood flow problem rather than a nerve squeeze problem. We certainly think of blood flow problems in people who've had trouble, for example, like having had a heart attack or having had stents, and in smokers, because those people will more often have poor circulation in addition to other problems associated with those entities. So, history, physical examination, and lastly, it's pictures. X-rays, sometimes helpful looking at the structure, but not really, because X-rays don't show us the space for the nerves. Really, the MRI, which is what this is the standard to look at a patient's body. The MRI is an electronic set of pictures. They're not photographs, but they're images that help us to look at the spine. It's non-invasive, and there's no X-rays involved, which there's no radiation. If somebody can't have an MRI, and those people would be somebody who has a pacemaker or some electronic device in their body, some types of implants into the eyes or the brain that are magnetic, they can't have an MRI. Then they get typically what's called a myelogram with a CAT scan. A CAT scan alone, which is an X-ray test that kind of slices you up like a loaf of bread, kind of like the MRI, but uses X-rays, by itself is not a great tool, because the CAT scan shows us the bone structure. What we really are interested in is where the nerves are. And the trouble with a CAT scan alone is it doesn't give us a good, clear picture of where the soft parts are, where the nerves are. And so what a myelogram is where the radiologist injects some dye into the spine and basically sloshes that up and down the spine, and it outlines the space where the nerves are. And then we get a CAT scan, so we can see the bone structure and the space for the nerves. And that gives us the ability to tell, is there narrowing or not, and where is it, okay? So that's how we diagnose spinal stenosis. Again, the history is probably the most important thing. And then how do we treat it? Well, it depends on how bad the symptoms are for people. If they're mild, they get occasional numbness and tingling or pain in the legs, just living with it is certainly safe. It's usually something that develops over a long period of time, so people often will have already been living with it for a while. Usually they don't come to the doctor when it first starts because it doesn't bother them very much. There are some medications out there that can be used to help manage the symptoms of the neurogenic or nerve-related pain down the legs. These medicines, gabapentin, Neurontin, Lyrica, are drugs to help reduce the sensitivity of the nerves. They're not pain medicines like opioids, but they reduce the irritability of the nerves by altering the chemistry of the nerves. And in some patients, they can be a useful tool in trying to manage the symptoms, at least for a while. They're not curing the cause of the problem, but they're helping to manage or treat the symptoms. A second level up of trying to manage the symptoms are what are called epidural steroid injections. In simple terms, it's a cortisone shot into the spine where the doctor injects some medicine, steroid medicine, into the area around the spine where the nerves are getting squeezed. And the steroid, which is a very strong anti-inflammatory medicine, can help to reduce inflammation of the nerves caused by the squeeze. Neither the medicine nor the epidural injections are curing the cause of the problem. They're only treating the symptoms, so it's a management tool. Where would we use those? Well, if people have mild to moderate symptoms, if people don't want to have a more aggressive treatment like surgery, or if they're a poor candidate for something like surgery from a health perspective, we would try managing it that way. So I mentioned surgery. Well, surgery is kind of the mainstay of trying to help this problem. And in simple terms, basically what we're trying to do is make more room for the nerves, okay? And we do that by, say for example, if there was stenosis at this level, which is called L4, what we do is we remove the bone from the back here to take that narrow tube, remove the back of it to make it more of an open channel. That's up, okay? So basically it allows the nerves to enlarge and flow where they want to go, and we remove the pressure on the nerves in the center. We also remove some bone in the sides to take the pressure off the nerves where the nerves come out, okay? Now, depending on the patient's problem, sometimes they have to have additional surgery done at the same time, which is basically improving stability of the spine. We're not going to really talk about that at this point. Just leave it as we want to take the pressure off the nerves. The good news is surgery for spinal stenosis problems is really pretty effective. We hope to get about 80 to 90% improvement in the hip and the leg pain problem when people are up and walking in about 90% of patients. Complications aren't common. Infection, nerve damage, and spinal fluid leak are kind of the top 3 potential surgical complications, but they don't happen often. Surgery recovery is relatively short. Usually people are back into their activities within 6 to 12 weeks, and they feel much better. The trouble with anything we do is because this is a age-related wearing out process, people who live long enough can develop similar types of problems either at the same area, it can come back, or more likely in other areas. So we're not curing the disease, so to speak. We're managing the symptoms at the time that we're dealing with them. So it is a long-term problem. The good news is most of the time our treatments are very effective in helping people get their lifestyle back and get their function back. They're able to walk better, their legs don't hurt as much, they feel more energized, and their lifestyles improve. So for those people who have spinal stenosis, particularly if you're healthy and active and really want to be active, I encourage you to seek out care earlier rather than later. Why waste a third of your life not being able to do things you want to do with something that can potentially be fixed or taken care of? So that's my spiel, I like that word, my spiel on spinal stenosis. Again, I can't talk about everything and all the detail in these short segments, but I hope this gives you a reasonable idea about what we're up against and what's going on. So again, we talked about what is spinal stenosis, what are the symptoms of spinal stenosis, what causes spinal stenosis, how we diagnose it, and how we treat it, okay? So I hope this has been helpful to you. Again, we're still working out the kinks in the whole The Doctor Is In Live with TOA Facebook thing. So please bear with us. I think we're getting a little bit better at it, I hope. I'm going to be gone for the next couple of weeks. So first off, I hope you guys have a good Thanksgiving. I will be back. Our next episode will be episode number 5. And I think the title of that episode is My Arm Hurts and It's Numb. Am I Having a Heart Attack? What we're going to be talking about is pinched nerves in the neck going down in your arm. So I hope you do have a good Thanksgiving. I hope it stays warm wherever you are. Again, if you have any questions, you'd like to communicate with us, please do. Please feel free to email me. My email at work is stahlmangc, STAHLMANGC @TOA.com. You can get a hold of us and learn a little bit about TOA, physicians, our practices, locations, and whatnot by going to www.toa.com. I don't know anything more about the worldwide interwebs such as Face Chat and Snappy Cat and all that kind of stuff, but we do all that kind of stuff. I'm old, okay? But in the meantime, take care of yourself and go out there and live your best life.